This podcast is brought to you by Meteorate.
So welcome, ladies and gentlemen, to podcast number 7 of the Seriously Funny Wellbeing Show. I'm your host, Homer Papantonio, and with me is the revered Dr. Ross Walker. How are you, Ross?
I'm very well, thank you, Homer. Very well. Looking forward to today's segment.
You've been circumnavigating the globe of late, they tell me.
Yeah, I week before last I was in Singapore, and I just got back yesterday from China. I was in one of the cities, a small city in China of only 12 million people called Hangzhou.
Yep. And
we launched the tribiotic that I designed that has my favourite gut bacteria in it called Akkermansia muciniphila, which I hope will be a bit of a blockbuster.
Okay, we'll get into that at some future point. So let's start off with a little bit of a joke, and this little joke is on testicular well-being. Ross, are you familiar with that at all?
I hope it's not a bit of a balls up, this one.
No, it's a joke that I do quite often during my talks, and I really like it, even though I've actually recited it a few million times. It goes like this. From wrestling, I learned a lot of valuable rules that can be used to succeed in the corporate world. But the highlight of my wrestling career, when I was selected for the Italian Junior Wrestling Championships back in 1988, in my first bout, I drew the great Russian Yuri Cherkov. Ross tells me you have a different connotation for Cherkov here in Australia. Anyway, Cherkov, the revered middleweight, was credited with one of the most feared holds in this sport, the Ukrainian full Nelson deathlock. And I remember at 30-odd seconds into the bout being paralysed by this hold. Not only was I physically trapped, but my mind was in shock. And I remember my coach's eyes burning into me like laser rays. I was shut down, my sweat-blurred gaze narrowed as I heard the death rattle of the referee's count. 1, 2. At this point, my sight narrowed in on a solitary testicle resting on the bridge of my somewhat distorted nose. I lunged forward with the only weapon I had, my teeth. In the next instant, Cherkov was a missile, catapulted out through the ropes and out into the crowd. A hush went over the audience. I felt like Houdini. I had escaped from the inescapable. And it's truly amazing what you can do when you bite yourself on the left testicle. So that's how we're going to kick off. I love that one. It always, even though people have heard it a few squillion times, it's an old Billy Connolly joke from many moons ago, and there's no copyright on jokes. Did you know that, Ross? There's no copyright.
I didn't know that, but whilst you mentioned Billy Connolly, can I say, if anyone would love a laugh, and I've watched this 3 or 4 times, and every time I do, I cry, is Billy Connolly talking about his colonoscopy. So please, anyone listening or watching this, please go to YouTube, Billy Connolly colonoscopy. It is one of the funniest things you'll ever watch.
But if you've got a phobia to the F word, I suggest you not go there. Because he does
probably not.
He gets away with saying that word 500 times.
Look, again, as my favourite comedian, I think the world's greatest comedian, in my view, Ricky Gervais once said, "You find it offensive, I find it funny. That's why I'm happier than you are." So if people find things like that offensive, get over it. It's called humour.
And that's why we're doing this show too.
Absolutely.
So medical news. There's a link between PBA, plastic, and insulin resistance.
No. BPA, which is bisphenol A.
Okay.
So bisphenol A is a commonly used chemical in plastics to give plastics that harder consistency.
Yep.
But it was found a long time ago that there was an association between people that use a lot of plastics. And I defy you to open your fridge and find something that's not in plastic in the fridge, as one example. But there's long been this association between BPA use and things like diabetes, obesity, a lot of hormonal issues, even behavioural abnormalities in children have been associated with BPA. But there's never been any study to show a direct causal link that exposure to BPA actually does any of the stuff we're talking about. So this is why this is a bit of a groundbreaking study that was recently published at the American Diabetic Association. And what they did, it was a double-blind study. So basically went over 4 days. They took 40 healthy non-active adults, 22 females, 18 males, and for the first couple of days, they put them on a low BPA diet. So didn't expose them to anything that was wrapped or came in a plastic container. But then for the next couple of days, they put one group onto a high BPA diet and the next group onto a low BPA diet. And they did a thing called the insulin clamp technique. So this is the scientific way to assess people acutely for insulin resistance. Now, insulin resistance is a gene abnormality that affects 30% of Caucasians, 50% of Asians, and 100% of people with darker or olive skin, my friend.
Yep.
And so you probably are insulin resistant. So as soon as you expose people to Western rubbish who have this gene, that's where all the problems come out. That's why you've never seen a skinny Tongan, because they're the world champions of insulin resistance, and they're also the world champions of obesity.
Yep.
So this study showed that those people who were exposed to BPA, as opposed to those people who weren't, had much worse features consistent with insulin resistance. And as I said, it's a world's first trial that shows this. And so the takeaway message from this is try to reduce your exposure to any form of plastic. So don't drink out of plastic bottles. If you're going to drink fluid, drink it out of something stainless steel or glass bottles. And also try to minimize your exposure to stuff that is contained in plastic.
Okay.
And when it says...
As a cyclist, I know for a fact that a lot of the people that manufacture the bidons, the bottles that go in the cage where most cyclists ride, quite a few of them claim that the plastic that they use doesn't leak. Is that...
No, well, they're saying it's BPA free.
Yes.
But then they use the thing called bisphenol S, which is just a different form of a similar chemical. It's a bit like the same thing about trans fats. So in New York, they don't cook in trans fats anymore. They use a process called interesterification that still creates synthetic fats. They're just not trans fats. So people think, it's better for them because they're not using trans fats. So I just think it's a very simple message here.
Okay.
The more natural your life is, the better your health is. And this is just one other example of that.
Okay. Future of medicine. All I've got here is surgeon python teeth.
Yeah, well, we're not suggesting that surgeons should actually start getting python teeth, but this is a really interesting stuff because a lot of the great innovations come from nature. So, for example, the benzene ring, which is the basic chemical ring of many different chemicals, carbon-based life forms have a lot of benzene rings in them. The fellow who actually discovered the benzene ring had a dream of a snake biting its tail. And then he discovered the benzene ring when he woke up from the dream.
Yep.
But this surgeon looked at the shape of python teeth, which and python basically have these sharp backward curving teeth.
Yeah.
And so they get their prey and grab onto the prey, so the prey can't get away from the teeth. So it doesn't rip the skin; it just holds onto the skin and clamps it down. Yep. So the surgeon had this idea, a guy from Columbia University, that if he designed little forceps that were shaped in the same way as python teeth, he'd be able to grab ruptured tendons this is for rotator cuff disease.
Yep.
So rotator cuff's a very common shoulder injury. And in fact, more than 40% of people over the age of 65 have some problems with their rotator cuff. And what he found was that by using this particular clamp based on the python teeth, that he got much greater traction on the tendon to allow it to be sewn in better to the bone. So he's done these experiments now on cadavers and on animals with ruptured tendons with incredible success. So the next step is to use this in human trials to see how much it works. But from the early works, it seemed, and they're using some 3D printing with this as well. So with the early work of this, it's very promising because I can assure you many people are listening to this podcast as we speak,
Yes.
so to speak. And they're saying, oh, yeah, I've got a problem in my shoulder, or I'm going to the shoulder surgeon, and they're talking about an operation. Well, this is going to give a much greater success because tragically, there's about a 20% failure rate in people that have their shoulders repaired, and in people over the age of 65, well, even much older than that, who have their shoulders repaired, there can be up to a 94% recurrence rate. So anything at all that makes the surgery better is great news as far as I'm concerned. So future of medicine, hopefully not too far off.
Okay. The body of evidence now, something I've known for quite a while, heavy resistance, long-term benefits for older adults. Now, this is not just in the context of increasing muscle mass and strength. It's also, there's something that interests me is that if it's done from machine to machine fairly quickly, it also has an effect on VO2, heavy resistance. So what's that research show, Ross?
Well, this was a study of just over 450 older adults and put them into three groups. One group was the heavy resistance training, where they used active heavy machines to strengthen their legs and their arms, et cetera, as opposed to the moderate resistance training, which is more just things like squats and push-ups and basic things. And the heavy resistance training, group number one, was done in a gym, supervised in a fitness centre, whereas the moderate resistance training had one session a week at the hospital and advised to do 2 sessions by themselves at home. And then there was the non-exercise group that just basically were allowed to do what they liked, but those people kept their exercise down to less than an hour a week, which you and I both know is absolutely substandard.
Yep.
And surprise, surprise, they found that those who did the heavy resistance training had the much more beneficial results. So much less visceral fat mass, a better isometric leg strength, and in fact, brain and thigh MRIs were much better after this is 12-month study, and they followed it up from three years after that. Now, they didn't say whether the people continued the resistance training, but this is the thing about clinical trials. Anyone who's involved in a clinical trial of any sort does better than people who are allowed to just do things by themselves because they're supervised. So again, if you're going in the Olympics, you need a coach to supervise what you do and to monitor what you do. And it's the same thing with your health. If you want your health to be at its best, have a coach, have someone who's going to be there and keep on your case. And that's why I assess people on a regular basis, because after 45 years of doing this job, they're the people I see who do the best. And often I see someone I haven't seen for 8 or 9 years, and I told them to come back in a year or two's time. They come back 9 or 10 years later, and they've wiped out half their heart because no one's been assessing them. But the people who get the regular assessments are the ones that do the best. So what I'm saying is, even this study where people were assessed for 12 months and followed and were advised to do the exercise, after 4 years, the end of the study, they still did better than people who did the lesser exercise or no exercise. So the message is straightforward. It doesn't matter what age you are. The more you exercise to your limit, not pushing yourself beyond your limit,
no.
but the more you exercise, the more benefit you're going to get.
Yeah. And I think more people would be motivated to do the heavy resistance stuff if they knew about ailments such as sarcopenia.
Let's not use terms like that, because a lot of people haven't heard. Everyone's heard of osteoporosis, weak bones, but they haven't heard of sarcopenia, which is weak muscles.
Yeah, that's what I'm saying.
And they don't realise that strengthening your muscles protects your bones as well. So you're going to get much less osteoporosis if you maintain good muscle mass. So avoiding sarcopenia, very important.
But what you're saying there, that's great. Do that 3 times a week, but there should be some time off for moderate aerobic activity between that too, like walking, cycling, swimming, whatever they want to do. Yeah,
I think exercise, the dose of exercise I suggest to everyone, 3 to 5 hours every week, that should be 2/3 cardio, 1/3 resistance training. But it's important to say, I do my walks for a half an hour every day. That's not enough. You've got to also have the resistance training.
Yep. Okay. Next one is intake of processed foods.
Yeah, this is the thought of the day.
Yeah, okay, thought of the day.
The thought of the day is a recent study of nearly 23 years follow-up showed that those people who had the highest intake of ultra-processed foods, which means anything in a box or a container with a use-by date or anything from a takeaway food outlet, had a 10% higher death rate over the follow-up period. So the message here is very simple. We've said it before. The more natural things that you eat and drink, the better it is for you.
Yes. And the final one, controversies, is multivitamins.
Yeah, this is something's been going on for years. Conservative doctors will tell you that all you get from vitamins is expensive urine.
Yeah.
Now, I don't disagree with that, but I also think you get valuable and expensive blood as well. And what you don't need, of course, you urinate out.
Yep.
But this study would suggest that what the doctor's saying is right. And this is a beautiful segue into our topic of the day. But I'll tell you about the study. It's just over 390,000 people in the US, and they followed these people. These people had no history of any chronic diseases at the start of the study, and they followed them for over 20 years, and they found out that those people who took a multivitamin, so it wasn't a randomized controlled trial, it was just looking at the people who took multivitamins as opposed to people who didn't take multivitamins. And at the end of the study, there was absolutely no difference in death rates, cardiovascular disease, cancer, nothing at all, no benefits whatsoever. But they suggested, well, it just could be anyhow that the people who take multivitamins, it's a marker for people who are more health conscious. I'm not sure where the logic of this conclusion comes when they say there was no difference. And then they were saying people who are sicker might take multivitamins because they think they're going to make them better. So I'm going to go through in our topic of the day why this is all nonsense. But interestingly, another study was released in the same week, and it was the third major study of a thing called the Cosmos trial, which looked at about 5,000 people over the age of 65 who took multivitamins, and it found that those who took multivitamins had much better thinking processes and memory.
Yeah. And
so
the other thing is also specificity and dosage. Quite often, for instance, vitamin C doesn't work because people don't take it at a high enough dosage to have an effect on maybe duration, prevention, even curing.
We'll talk about vitamin C at another segment. That's actually a very good topic, which I'll just remind myself to talk about. So vitamin C, and talk about the preventions of colds and other diseases with vitamin C. So we can that in itself is a very good standalone topic.
But even treating some cancers too with vitamin C. Yeah.
Well, yeah, and there's also some work with
sepsis.
Sepsis, the whole thing. There's a whole lot of things with that as well. But this is a beautiful segue into our topic of the day. And the topic of the day, people are going to shake their heads and say, what on earth?
Is methylation. And I've tried to make sense of this because it's something I thought I'd had a reasonable grasp of well-being and health, but when you throw methylation. So methylation is the invisible process in charge of your gut, hormone, and mental health. It's the transfer of simple molecules in the body to bioactive compounds. The process of methylation captures non-usable raw materials in the body and turns them into usable materials. When methylation is functioning properly, a methyl group consisting of 4 atoms, 1 carbon and 3 hydrogens will transfer from one molecule to another. It's like turning on a light switch in the body. When methylation is turned on, this process can optimize heart health, sleep, libido, hormones, gut health, mental health, and so much more. When methylation is turned off, many processes of the body will struggle to function at the highest level. So who should care about the methylation process? The answer, Ross, is everyone, but particularly people who struggle with food sensitivities, poor sleep, hormones, thyroid issues, or chronic illness. Over to you, Ross.
Okay, well, look, that was a reasonable summary, Hammer, but again, that's why you're you and I'm me. So it doesn't really explain, it makes it a bit too difficult. I'm going to try and explain to people why methylation is important.
Go on.
You've explained pretty well what it is. It's basically these methyl groups, which are tiny little chemicals that are tags, especially on DNA, proteins, RNA, etc. But I want to go back to what I call genetics 101. A lot of people don't understand this, but with a gene, we have around somewhere between, they haven't really figured out exactly how many, but somewhere between 20 to 25,000 genes in our body. Strangely, a mouse has 48,000 genes. So you think, well, hang on, we're more complex than a mouse. How come we haven't got as many genes? Well, it's because it's much more complex than that. And I'll try to explain it as we go on. But with every gene, every single gene of those 20,000, we'll say it's 20,000 just for the purpose of this discussion, every gene is paired. One gene from mum, one gene from dad. Okay, so that's genetics 101. And with each individual gene, so you've got a DNA in each molecule, in each cell, but you think about it, it's the same DNA whether it's in your liver, in your teeth, or in your brain. So why aren't we growing teeth in our brain? Why aren't we growing teeth out of our liver or growing a foot out of our kidneys? Well, the reason we're not is that most of the genes that are in that DNA are being suppressed. And what are they being suppressed? They're being suppressed by methyl tags.
Okay.
So you want to have appropriate methylation to keep most of your genes suppressed. And it's not as simple as that, but it's the best way to explain it. So the methylation process is a key process in gene regulation to keep the genes switched off when they should be switched off. And that's a key. But one of the big things now that everyone's talking about in science is epigenetics.
Yes.
So people think I'm the victims of my gene because every single disease is genetic. Your risk for heart disease, cancer, Alzheimer's, diabetes, osteoporosis, it's all genetic. Even your reaction to infection is genetic.
Genetically predisposed.
Yes.
So the degree of that predisposition.
Yes. Every disease is genetically based. Now this is where everyone's getting it wrong. When you hear me say it's genetic, but hang on, my dad didn't get it and I did. So therefore it can't be genetic. It doesn't work like that.
Yep.
I've got families where there are 5 siblings, 3 have vicious disease, 2 have nothing, but they came from the same parents. Now, why is that? Because every gene is a coin toss. So you can either, with each individual gene, there's only 3 possibilities. 2 good ones, one from mum, one from dad, a good and a bad one good one from mum or dad, one bad one from mum or dad, or 2 bad ones. That's the only possibilities with each gene. They might be varying degrees of badness or goodness, but they're the only possibilities. So, for example, in cardiovascular disease, we've mapped about 300 genes already for cardiovascular disease, cardiovascular function, out of the 20,000. Already we've mapped 300. So if you've inherited 200 dodgy genes out of your 300, then you'll probably get cardiovascular disease in your 40s and 50s. But if you've only inherited 10 to 15 to 20 of those genes, you may never get cardiovascular disease. And so that's where people are getting genetics wrong. They think, oh, my dad had heart disease, therefore I'm going to have heart disease. Or my dad and mum didn't have heart disease, so therefore I can't get it. Doesn't work like that. So it's just the combination of all of those different genes that work together to give you your predisposition.
So Ross, can I just ask, do you think we're getting closer to negating that genetic predisposition through lifestyle and maybe advances in medicine and everything else?
Well, of course we are, because this is what I'm saying. We're not the victims of our genes. We're the masters of our genes because of the whole concept of epigenetics, which means the interaction between gene and environment. And that's the key. So, for example, I'll just give the example of smoking. if someone's foolish enough to smoke, people still smoke, which is a ridiculous thing to do. Oh, no, I vape. That's so much better for me. No, it's not. That's another topic. But what I'm saying is if people are smokers, 20% of smokers get lung cancer. And there are people who've never smoked, never lived with a smoker, who still can get a different type of lung cancer that's not cigarette related. But if you're an optimist, that means that 80% of smokers don't get lung cancer.
Yep.
So what I'm saying to you is the people who have the genes that predispose them to lung cancer, that then is triggered by the smoking, so activates those genes, whereas the methyl groups keep them inactivated, but the smoking overrides that and pushes them off towards lung cancer. So that's just one example of how an environmental trigger such as cigarettes can trigger that gene that's sitting there dormant and switched off by the methyl group that then becomes activated, then becomes a cancer. Okay, so that's epigenetics. So epigenetics is how your environment affects your genes.
Yep.
And this is where the whole concept of methyl groups is very important. So the key players in methylation are what we call, and people are going to roll their eyes now because it's getting a bit scientific, but a thing called the MTHFR gene, methyl tetrahydrofolate reductase gene.
Yep.
Now you say, well, why is he carrying on about this nonsense? I'm carrying on about it because 50% of people are born with a mutation in this particular gene. And there are two main mutations. One's called the C mutation and one's called the A mutation. As I said, you get 2 copies of every gene. I inherited from mum and dad, thanks mum and dad, 2 copies of the worst mutation, which is the C mutation. So I've got 2 C copies, not a good thing to have. So
what does that mean?
Well, I'm about to explain to you. So basically, with this MTHFR gene mutation, which affects 50% of people, so when you do the blood test, the MTHFR gene blood test, 1 in 2 people will have some abnormality there. So if you've got the worst type that I've got, the 2 Cs, that markedly increases your risk for vascular disease as you get older. Or when you're younger, it can also increase your risk for infertility. Certainly didn't work for me with 5 kids.
Yeah.
But then you can have the C and the A gene together. We call that a compound heterozygous, or you can have 2 A's, or you might be completely normal, the 50% of people that don't have any mutations with this. Now, I want everyone to remember this because this is going to become relevant soon. So the MTHFR gene, and the way you can tell as you get older how it's affecting you is by a blood test called homocysteine. So the gene abnormality tells you you've got the problem in the first place, but the homocysteine level tells you how much it's affecting your blood system. So if I don't take a particular compound I'll talk about in a second, my homocysteine sits well above normal. So normal is below 10, ideal is below 7, and I sit at around 17, 18 without this particular substance that I'll get to in a second. So when I'm assessing somebody's methylation status, I get an MTHFR gene, I get homocysteine levels, and I get a B12 and folic acid level as well. And that'll become relevant as we keep talking about this. So now going from there, this methylation process, this MTHFR gene, is so important in putting these methyl tags onto DNA, RNA, and protein so you can regulate the action of all of these proteins. So a good source of high-quality folic acid and other B-group vitamins are fruits and vegetables. But the problem is, Homer, that less than 10% of people would have 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables per day, especially the leafy green vegetables, which are full of high-quality folic acid. So that's problem number 2.
Now, is coffee bad for methylation?
No. Look, you're thinking, when you gave your introduction, you're thinking about what's called the over-methylators and the under-methylators.
Yes.
I don't want to get into that today. I don't think that's that relevant to this. Yeah. I'm talking more at a disease level. See, the over-methylation, under-methylation, there are clinics you can go to, MTHFR gene abnormality clinics, and if you've got some symptoms, you might be an over-methylator, sometimes you might be an under-methylator, and they do some adjustments with naturopathic treatments. I'm not talking about that. I'm going more at the disease level now.
Yeah,
but I'm not demeaning that. I'm just saying I don't want to go on a tangent that's getting too complicated. I just want to stick to this methylation discussion. Okay. So what happened? People sort of semi-understood this 20, 30, 40 years ago. When I started cardiology 40 years ago, I worked with a fellow called Professor David Wilkin, who was one of the world experts in homocysteine, this toxic amino acid that comes from the MTHFR gene. But so everyone said, so the big thing is we all need folic acid. Yep. And this is going to get relevant to our myth or our controversy. So they put folic acid, they fortified folic acid into foods. They gave pregnant women folic acid to stop spina bifida, which is another problem with the MTHFR gene. If you're a mother with this MTHFR gene abnormality and you don't take folic acid during the pregnancy, you might have a child born with spina bifida. So we've almost reduced the incidence. Well, not almost. We've almost eliminated spina bifida because of this folic acid supplementation. But here's the problem. If you have one of the gene abnormalities with this, that I have, and you take standard folic acid, you don't metabolize it properly because you have an MTHFR gene abnormality, and this unmetabolized folic acid increases in your bloodstream, which as you get older can really stuff around your immune system and increase your cancer risk.
Okay.
I'll get onto that a bit later on, because there was a study done. I'll talk about a study right now. A study done of 643 males to see whether folic acid reduced their risk for prostate cancer, for colonic cancer, and but they also looked at their prostate cancer risk, and they found that those taking folic acid had a slightly higher prostate cancer risk. And I think it's because they use standard folic acid, which I don't think should be used anymore.
Yep.
Not the new sort of folic acid, the fourth generation folic acid that completely bypasses the MTHFR gene abnormality and lowers your homocysteine. So this is the key point. So this study of 643 men, average age about 57, 10-year follow-up, those who were given 1 milligram a day of folic acid, not folate, different thing.
Different.
Folic acid, that's a synthetic chemical, had 3 times the rate of prostate cancer. And they found that children born to mothers who had this MTHFR gene abnormality and had high levels of unmetabolized folic acid at birth had much higher rates of food allergies. Yep. So we're seeing much more food allergies now coming on in children. And I think a lot of this is that a lot of the mothers have been flogged with folic acid.
Yep.
A lot of people don't realise this. Also, in the elderly people who are getting cognitive decline, there's a condition that you may or may not have heard of called pernicious anemia. Have you heard of that one?
No, pernicious anemia.
Pernicious anemia is a stomach disorder. And in this stomach disorder, in your stomach, you make a thing called intrinsic factor that links onto B12, and lower down in the bowel, in a place called the ileum, which is the last bit of the small bowel, you absorb your B12 with intrinsic factor. So if you have pernicious anemia, you get this gastritis, this what we call atrophic gastritis. The stomach doesn't work properly. You don't make intrinsic factor. You don't absorb B12. Very, very common in older people. So probably 5 to 10% of older people have a degree of pernicious anemia where the B12 levels start to drop. You give them unmetabolized folic acid and it markedly increases their cognitive decline. They don't think as well, possibly go on to increase the risk for dementia. But also there's an interaction with a thing called B6, vitamin B6 or pyridoxine, which can increase their risk for peripheral neuropathy. So they get pins and needles in their feet, pain in their feet, if you give them unmetabolized folic acid on top of this low B12. Okay, so it's all becoming a bit interesting and clear. So the MTHFR gene abnormality, simple blood test. I suggest everyone has one test. You only need it once to see whether you do or don't have the gene. If you're under 50 and you're having problems with fertility, you certainly may have a problem with the MTHFR gene, or you may have some mental health issues. So that's how it manifests people under 50. Over 50, your homocysteine starts to go up, more cardiovascular disease, cancer, neurodegeneration, Alzheimer's disease, Parkinson's disease, depression, liver and kidney disease, and diabetic neuropathy, where the diabetics get the peripheral neuropathy as well. Okay, so there are all the concerns with it. Now, what evidence do I have with all of this? Well, firstly, we spoke about the multivitamin study before, and I believe the reason why the multivitamin study didn't show any benefit is that the multivitamins people were using had standard folic acid, which I don't think people should be even thinking about taking anymore. And I would say well over 95% of multivitamins around the world have standard folic acid. So it means 50% of people are taking the wrong thing.
Right.
But let me give you some studies that showed some benefits of multivitamins. I've already mentioned the cognitive benefits. And a mate of mine called Professor Andrew Papinkas down in Melbourne, works at Swinburne University, has done some very elegant work where he showed that multivitamins don't work as well unless you have a good level of omega-3.
Yes, I was going to bring up omega-3.
Yeah. So, and this is the point. People say, oh, I'm taking this one thing. It's the combination of all of these things. There's never, ever one cause for anything. It's how it all sort of melds in together. So I'll give you, there's a little-known university in America called Harvard.
Harvard, yes.
And Harvard have been doing for the last 30 years the Nurses' Health Trial, the Male Physicians Study. So that they basically looked at about 180,000 people and all of their various health issues, what supplements they take, what pills they're on, how much exercise they do, what food they eat, how many of them smoke, drink, et cetera, over this 30-year period. Part of it was a sub-study on multivitamins. And when they looked at the multivitamin intake in the physicians up to 10 years, the multivitamin did absolutely nothing. But when you looked at the 10-year data, there was an 8% reduction in common cancers and cataracts, which is, you say 8% is not a lot, but it's taking a harmless multivitamin every day, especially with a crappy folic acid in it, without the proper folic acid, it's still not bad.
No.
But when they got to 15 years in the women, there was a 75% reduction in bowel cancer, a 25% reduction in breast cancer, a 23% reduction in cardiovascular disease. When they looked at the data in men at 20 years, and what anally retentive neurotic would take a multivitamin every day for 20 years? Well, Homer, you're looking at one.
Yes.
It was a 44% reduction in cardiovascular disease. Now, that's better than a statin.
So we're talking about your old bicycle versus racing car analogy.
Exactly. So let's just say that one again for people who haven't heard it.
Yeah.
A pharmaceutical drug is like a high-performance motor car, gets you from A to B very quickly, but you've got to have seat belts, safety rules and safety mechanisms in the car to stop you from crashing or killing yourself.
Yeah.
Okay? And that's the same thing as drugs. Drugs have a very quick acute effect, a very strong effect, but a potential for strong side effects.
Yeah.
Whereas supplements are like a bicycle. A to B much slower, but you get some exercise along the way. You just need to wear a helmet and keep away from cars and pollution, and you'll get the benefits from doing that, but it'll take a lot longer to get there. And it's the same thing with supplements. Supplements are like the hare and the tortoise. It's the long game you've got to play with supplements. So don't take something for a few months and go, oh, didn't seem to do much, so it was a bit expensive, so I stopped. Nonsense. You've got to wait and see what happens over a long period of time. So that was the Nurses' Health Trial. But then they looked at a thing called the Iowa Women's Study. 20-year data, Iowa women taking a multivitamin every day did nothing. But you know why? The people who live in Boston are a much more, have a much better diet, much better lifestyle. So if you throw the typical Iowa diet, which is more of a rural area, and they just don't look after themselves as well, no supplement's going to override bad living. It's like you can't outrun a bad diet. So the Iowa Women's Study showed nothing. But then there's another little-known university in England called Oxford. And a fellow called Professor David Smith has done a thing called the Optima trial and the VitaCog trial. And both of these studies showed over a 3-year period that if you took a combination of folic acid, and they didn't even use the proper folic acid, B12, B6 over 3 years, there was a significant reduction, 30% reduction in progression from mild cognitive impairment to dementia. With the VitaCog trial, they found that the only people who got that benefit were the people who took omega-3 with the folic acid B12, B6. Then there was a trial in China of about 20,000 people, just over 20,000 people with blood pressure, but without vascular disease. And they gave them a standard blood pressure drug called enalapril and added folic acid. And they did this as randomized controlled trial. So it was enalapril by itself or enalapril and folic acid, but it was standard folic acid. And they found out that the only people who benefited in that trial were the people who didn't have the MTHFR gene abnormality. So they had much less stroke. Also, interestingly, published in the World Journal of Gastroenterology, folic acid reduced over a 3-year period colonic polyps. And they've done the study in mice as well, showing the same thing, that those who were supplemented with a multivitamin-like treatments had less colonic polyps.
So Ross, if you have enough time, is the preferred option from pharma and from the drawbacks of pharmaceuticals, if you have enough time, supplements?
Yeah, no. You see, I don't think it's either or. I think what doctors have to do is look at people's risk. And so, for example, I'll give you a personal example. My father died of bowel cancer when he was 72.
Yeah.
Okay, so I'm about to front up for my 5th colonoscopy. Please watch the Billy Coley colonoscopy segment on YouTube. But in the 4 colonoscopies I've had to this point, I've never had a polyp. I've been on all of this stuff for the last 20, 30 years.
Yeah.
And I look after myself probably a bit better than my dad did. My father was a superb sportsman in his younger days, played rugby league for Queensland as an example. But when in his last 20, 30 years, really didn't look after himself that well. His body was a wreck from all the sport he played.
But that's also another conundrum, isn't it? You know, people assume that you're genetically predisposed because your dad had bowel cancer, but there might have been lifestyle issues that brought on.
Yeah, that's what epigenetics is all about.
Yeah.
But what I'm saying is I'm still going for the colonoscopy.
Yeah.
But if I had colonic polyps, I'd probably intensify my medical surveillance and look to other medical therapies, the pharmaceutical side of things, as opposed to just taking the supplements and looking after myself. So everything is 80-10-10. 80% lifestyle, 10% pharmaceuticals and other medical procedures if you need them, and 10% the use of supplements. So let's now move on to what should we do about this whole methylation conundrum.
Yep.
Firstly, I think if we're 30 to 50 years old, and all of us need to have the MTHFR gene performed so we know exactly what it does, what it is in our particular bodies. Say, for example, you're a 32-year-old woman who wants to have a baby. You've tried for 12 months, nothing's happening. Have your MTHFR gene done, go and see a fertility expert, and you might need to be on what I'm about to suggest very soon. So MTHFR gene over 30, but if you just say you're over 50 and you're listening to this, have your MTHFR gene done as well as homocysteine, B12, folic acid, and possibly even B6 in special cases, but I don't think it's essential. Everyone does that. And your aim is to run the homocysteine below 10, but ideally less than 7. And here's the key now. This is what I've been building up to. We should no longer be thinking about folic acid, but we should be thinking about the 4th generation folic acid, which is, now I'll say it very slowly, 5'-methyl tetrahydrofolate. Okay?
Right.
So 5'-methyl tetrahydrofolate, and the 4th generation version of this folic acid is the glucosamine salt of this. I cannot mention the name of the product because it's a TGA rule. Doctors cannot endorse particular products. I'm just saying the ingredient in this particular stuff. So there's only one multivitamin that I know about in Australia that contains this particular type of folic acid, this 4th generation folic acid, or you can buy the 5'-methyl tetrahydrofolate by itself. But please, the message I give to everyone listening is if you're going to buy your supplements, buy them in Australia, because Australian supplements are made to pharmaceutical grade. American supplements are mainly made to food standards. Now, some American supplements are still very high quality, but a lot of them are not. And you don't know what you're getting. So I'll give you one example. There was a supplement made in America called Oxy Elite Pro, which a lot of these athletes thought, oh, that would be good for me, I'll take that. But they had some contaminants in that Oxy Elite Pro, and 6 people had to have liver transplants after taking it. Don't take your supplements from America.
How about Chinese supplements from China?
Yeah, well, again, it just depends on the quality control. All I'm saying is get the supplements made Australia or New Zealand where they have to make them the pharmaceutical grade. So this 5'-methyl tetrahydrofolate, and also look, everybody should be having 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables per day. Now, the special concerns with the MTHFR gene are the high vascular risk, the cognitive impairment that goes on as you get older. The bowel cancer risk is very important there as well. And I'm sure Dad had a bad gene for that, but he didn't take the stuff I'm talking about. Infertility, and especially that low B12, which accentuates all the problems that go for all of this. So
mainly for vegetarians too.
Well, no, or for people like pernicious anemia with a low B12, whether they're vegetarians or not. But if a vegetarian's listen to this, of course, you should be supplementing with the 5'-methyl tetrahydrofolate. So that's my overview of methylation. It's pretty complex.
It is.
But I'll make it as simple as I possibly can.
It's one of the most complex subjects we've broached on this podcast.
I know, but it's so common and it's so important, and most people don't understand it. So I just try to make it as understandable and giving people strong, specific advice about what they can do about this, because it may be the missing piece in the puzzle of their health issues.
Okay. So before we go into questions, we're going to have a quick plug for the Best Wellbeing Program for your business. It's a global business camp. It's on during February 24th to the 26th, 2025 at the Crown Plaza on the Gold Coast, featuring a sensational speaker, a Dr. Ross Walker, I think his name, and apparently some shonky guy known as a corporate imposter. And to find out more, visit the Seriously Funny Wellbeing website at seriouslyfunnywellbeing.com and click on the Global Business Camp icon. We have some emails from viewers.
Before we do, I just want to tell you, this little Irish guy was fishing beneath the ice, okay? So he's fishing away beneath the ice, and this booming voice came out and said, "There are no fish beneath the ice." And he looked at me and said, "Is that your garden?" He said, "No, I'm the manager of the ice rink."
I love those. I love those. Those sort of basic jokes that are so corny. They're laughable. They're
dad jokes.
The quintessential dad jokes. Yeah.
I'm well known for my dad jokes. And look, my wife found out that I'd replaced our bed with a trampoline. She hit the roof.
Okay, we've got some emails from viewers, and if any of you want to email a question in, just go to hello@seriouslyfunnywellbeing.com. We have a question from Charlie in Melbourne on gut health after 50, and he asks, Dr. Ross, what are the top 5 foods to include in a healthy diet that looks after your gut and heart health?
Yeah, that's a great question. Let me make the point that 90% of common diseases have a relationship to the gut. So It all starts in the gut. And so even my specialty, cardiovascular disease, there is the gut-heart axis. There's the gut-brain axis, the gut-lung axis, the gut-immune system axis. 70% of the immune system is in the gut. So, for example, if you have poor gut health, 90% of serotonin, which is the happy chemical, it's the mood chemical, is made in the gut.
Yep.
So if you've got gut dysbiosis, so defective gut bacteria, you can often get depressed as a consequence of the defective gut bacteria. So as I say, I'll say this time and time again on these podcasts, the best thing anyone can do for their gut is have 2 or 3 pieces of fruit per day, 3 to 5 servings of a variety of vegetables per day, especially if those vegetables are high in fibre. So we just heard some news come out yesterday. A study done in mice showed that, and this is where epigenetics is so important, that the mothers of mice who are fed a high fibre diet, there was much less heart disease in their offspring, and that it suggested that people have around 30 grams of fibre per day, which is like having, I suggested in one of the podcasts, 4 prunes a day is great for bone health, but it's also very good fibre for the gut. But you have the 2 or 3 pieces of fruit per day. the 3 to 5 servings of vegetables per day, you specifically get that amount of fibre and all of the other plant chemicals known as polyphenols that help your gut as well. And I think it's important to take a good quality biotic. And I've just come back from China where we're launching my new tribiotic that has a very specific gut bacteria in it. But it's also part of that tribiotic is a prebiotic. So there's a prebiotic, probiotic, and postbiotic. Now, This is important when to answer Charlie's question. What are prebiotics? Prebiotics is the food that feeds for healthy gut bacteria. So things like garlic and onions, mushrooms, they're very good prebiotics. Kimchi, sauerkraut, any of the fermented foods, cheese, feeds into good, healthy probiotics. And then there's the postbiotics, and the postbiotics are the healthy chemicals made by healthy bacteria. So there's things we call short-chain fatty acids, which are things like butyrate, pyruvate, acetate. But I also mentioned the serotonin, which is another it's a postbiotic made by healthy gut bacteria. Ubiquinol, coenzyme Q10, is also made by gut bacteria. So they're all of the things I've just said, the fruits and vegetables, but specifically the prebiotic foods and some of the postbiotics I mentioned.
And did you include yogurt in there somewhere?
Well, yogurt's yogurt has probiotics in it. So the yogurt's very good for you as well, especially you're going to love this, especially good Greek yogurt.
Greek yogurt. But a lot of people go to the conventional yogurt that's got probably a bit too much sugar in it too.
Yeah. It's best to have natural, unsweetened Greek yogurt.
Yeah. Also from Charlie, is regular consumption of hot chili a positive or negative for overall digestive and gut health? Because there's things like cayenne pepper and
they're just sort of semi-supplements. But look, for somebody who, and the Italians tell me I'm an honorary Calabrian citizen because of my services to the bergamot fruit, but the many trips I've had to Italy, the Italians say, you have far too much chili. They tell me I have far too much chili. I love chili. I put it on everything apart from Weet-Bix. But it's really good for you because chili has a thing called capsicum.
Yes.
Capsicums are the stuff that actually give it its heat. But you get good metabolic benefits from doing that. So chili is very good for you.
But you not get the quintessential burning ring of fire in the morning too if you have way too much.
If you have, some people do. So I've got a cast iron gut, so it doesn't really worry me as far as that goes. But so look, this is the problem, Homer, that the one size never fits all for anybody. A lot of people have significant irritable bowel syndrome, and I think that's a form of gut dysbiosis that we've just been talking about. But a lot of those people benefit from being what Dr. Sue Shepherd pioneered, which is the low FODMAP diets. So some people are just very sensitive to specific types of food. For example, 50% of Asians are lactose intolerant. So if they have standard milk with lactose, it can really upset their gastrointestinal tract. So you've got to find out what works for you and what doesn't work for you. So if using chili really upsets your gut, don't use chili.
Yeah.
That's straightforward.
And when you were talking about fibre earlier on, I mean, I have a reasonably high fibre diet, fairly athletic, spend a lot of time. I mean, you can have 3 or 4 bowel movements a day.
Congratulations.
Short.
Better than having one every 3 days.
But there's some athletes I know that go 3 or 4 days without a bowel movement.
Yeah, and I think that's getting to the point of being pathologic. I think it's good to have 1 or 2 bowel movements most days.
They say after every meal, but that's another story. We have Peter from Perth. He has 2 questions. Can full cream milk be used as a viable substitute for indigestion medication? And what are the best ways to avoid indigestion?
So avoid indigestion. No, look. I think if someone's getting bad indigestion, also known as dyspepsia, heartburn, all of those things are really all around the same subject of indigestion. It's important to have a medical workup. It's not the right thing just to go and drink milk or to get some antacids from the chemist or maybe some over-the-counter PPIs like Nexium or Pariet or one of those things. I think it's important to get a diagnosis. And why is it important to get a diagnosis? That's not just going to have a chat with the doctor. It's probably having a gastroscopy. So if you've got pretty significant indigestion that's happening all the time, Why should you have a gastroscopy? 2 reasons. Number one, there is a thing called Helicobacter pylori that was discovered by Professor Barry Warren and Robin Marshall in Perth. And Barry he took a bullet for the side. He took a preparation full of Helicobacter and within a few weeks had severe gastritis and peptic ulceration. So I found that 90% of severe peptic ulceration is directly linked to Helicobacter. And you say,
Okay.
oh, well, so what? Just take a PPI and you get rid of it. No, wrong answer. Because if you've got Helicobacter setting up shop in your gastrointestinal tract, after 5, 10, 15, 20 years, that can turn into an esophageal or gastric cancer.
Okay.
So if you have Helicobacter, you want to eliminate it. You can do a Helicobacter breath test without the gastroscopy, and that might give you a pointer to Helicobacter, but it doesn't actually tell you how inflamed or affected the stomach is, number one. Number two, there's a thing called Barrett's esophagitis, where the lower bit of the esophagus changes the lining, and that is also precancerous. So if you have that Barrett's and you don't get it picked up and don't get it watched and treated, it can turn cancerous down the track as well. And how do these things manifest? With reflux, with heartburn, with dyspepsia. So please, if anyone's listening, Pete, if you're listening to this, don't just see milk as an alternative. Now, I have no problems with people using full cream milk, by the way.
Yep.
Study called the PURE study, 220,000 people followed for 9 years in 50 different countries. Those who had 100 grams of red meat on a daily basis, so averaged over a week, with 3 servings of high-fat dairy per day, had a 25% reduction in death and cardiovascular disease. So when people say, oh, you shouldn't have meat or dairy full of saturated fat, where's the evidence?
Yeah, I know.
It's just old stuff, old thinking, and science advances funeral by funeral.
Yep.
So to convince people that what they've been thinking for 10, 15, 20, 30 years is wrong is very, very difficult. But look at the evidence from the PURE study, the biggest epidemiologic trial in the world. So I've nothing against full cream milk, and I personally think it's better than skim milk. It tastes better, but also it's better for you because there's not as much sugar in it. And the evidence is that it does have some protective effects as well, as I just mentioned. But in terms of indigestion, I think that needs to be specifically investigated and managed. And it is, I think peptic ulceration and indigestion is another topic for a podcast.
Okay, we've got final 2 questions from Bruce in Cairns, who's asking about gout. And he asks, Bruce from Cairns, you feel like getting into an Aussie accent. What are the foods that might trigger gout in a person prone to that condition? And are there any foods or therapies that help ease the painful impact of gout?
Okay,
or is medication the only choice? Sorry for being disrespectful, Bruce, to you. Okay.
Yeah, it's a good question though, Bruce. And let me say that gout has got nothing to do with your lifestyle. Okay, let me make the point to everyone here. Stress of any sort, whether it's, and we should again have a full topic on stress.
Yep.
There are 5 categories of stress: emotional stress, mental stress, physical stress, pharmacologic stress, and infective stress. And any of those things can precipitate, but stress causes no disease whatsoever, but precipitates every disease.
Yep.
So the cause of gout is a genetic abnormality typically related to insulin resistance in over 90% of cases. We've already spoken about how common that is.
It's not uric acid buildup.
No, it is. It is.
It is, okay.
It's caused by having this genetic insulin resistance gene, which sets you up for high levels of uric acid.
Yep.
So then if you have that genetic predisposition to a high level of uric acid and have a heavy bout of high-rich foods like pate or alcohol or whatever, that may precipitate an episode of gout.
Okay.
So I personally believe gout should be 1 per customer because people think, oh, it's a very painful condition that really hurts my toe. No, it's more than that. Because you can get uric acid precipitation in your kidneys, you can get kidney stones, it can damage your kidneys, drive your blood pressure up. So gout is really a systemic disease of a high uric acid that needs to be treated. So if your uric acid level is high, I personally would give you a drug, allopurinol, to block your uric acid. But here's the problem. You have an acute bout of gout. If you start taking allopurinol at the same time, it mobilizes uric acid out of the tissue and makes your pain even worse. So the standard maintenance dose of allopurinol is 300 milligrams a day. So I start people, I get a 100 milligram pill, start them on 50 milligrams a day for a month, 100 milligrams a day for the next month, 200 milligrams a day for the next month, then up to the maintenance for 300 milligrams once their acute gout has settled. But when you get acute gout, you can try things like celery and a few other things that might give you a minimal benefit. But the reality is you need some painkillers. And any of the non-steroidal anti-inflammatory drugs can settle the pain down, things like Indocid, Voltaren. I think the safest one is a thing called Celebrex, 200 milligrams a day. Sometimes it might be that bad you even need some prednisone.
Yep.
And there's a very good anti-inflammatory that we also use in cardiology called Colchicine. So that's not Colchicine, that is Colchicine.
Culture.
And this settles the gout down very quickly.
Yep.
They're 500 microgram tablets, and you take one every hour up to 3 milligrams based on a few things. 1, diarrhea. So as soon as you start getting the squirts, you stop. 2, pain relief. So if you get pain relief after 3 or 4 pills, you stop. Or 3, you get up to 3 milligrams, you don't go any further than that. Then you might take 1 twice a day until the pain's gone. So colchicine's a great drug to treat acute gout. It's not a maintenance drug.
What about red wine? Bad for gout?
It's bad when you have an acute episode.
Yeah. Dark beer?
But any alcohol can help precipitate an episode if you are genetically predisposed to gout.
Okay.
Red wine, pate, does not cause gout. It's being born with the gene for insulin resistance where you have this high level of uric acid.
That's great. Okay, I think that's the end of the questions and end of the podcast. This is podcast number 7, Seriously Funny Wellbeing Show. Many thanks to everyone for tuning in, and thanks, Ross, for your expert commentary. And we'll see you next week on the Seriously Funny Wellbeing Show. Thank you.
Bye.